Today, we're going to touch on the importance of breast cancer screening. Very, very important. So let's bring in Amy Howell. She's a UNF nursing instructor and advanced practice registered nurse specializing in women's health. Thank you for joining us.
Thanks so much for having me.
We hear about it all the time, but why is breast cancer screening so important?
Screening is important for early detection, and we know that early detection is the primary reason that we have improved patient outcomes and survival rates from breast cancer. So screening is important for early detection.
And we talk about risk factors a lot, family history, genetics. How does that all play a role?
These are all very important, and you need to know what these risk factors are and know your family history, which is very important. Risk factors such as obesity, alcohol use, a sedentary lifestyle, smoking, things that we know are bad for our health in general actually do increase our risk of breast cancer as well.
Is there a way one can lower their risk? And if so, how?
Most certainly.
Okay.
Definitely by keeping your weight under control, by exercising, by limiting alcohol consumption, and by not smoking, as well as being sure that you have looked at your genetic risk, looking at your family history to see if there is a correlation for breast cancer.
Now, is there a difference in screening between a woman who has the risk factors versus a woman who doesn't?
Most definitely. So screening for everyone involves monthly self-breast exam and also screening mammograms, which usually start at age 40. That guideline has recently been reduced to age 38. However, you might need mammograms starting as early as 30 if you have a strong family history or if you're positive for one of the BRCA genes, which you might have heard called BRCA.
Yes, I've definitely heard of that. It is so interesting, science and technology and what we've been able to find, but it's still important, like you were saying, to do the self-breast exam. We talk about it a lot here at First Coast News. Jeannie Blaylock paving the way for, the self-exam here locally and bringing in the buddy bus. How cool is that? It's coming to the campus, right?
Yes, Friday, October 21st, 9 to 1. We'll have a registration link out for you guys, but please come on out and get your mammograms if it's time. But yeah, I actually remember Buddy Check 12 when it first started. So
yes.
Yeah, you guys are always a big part of October self-breast awareness.
Is there anything else that we may have left out before we go?
I just think that it's important to be sure that you're doing your monthly self-breast exams. A clinical breast exam once a year is something we should all have, but you live with your body every day. So it's important. You will find changes before your healthcare provider does. So it's important to just check in, look in the mirror, do your breast exam in the shower, which is what I recommend, but just do it regularly enough that you're going to find changes. Super important.
And then remind your friends and family that Buddy Check 12. Thank you so much for joining us today.
Thank you. Thanks for having me.
Of course. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.